Mr. President, are we in a quorum call?
We are not.
All right, thank you so much. Mr. President, I'm here today with my great friend, the senior senator from Missouri, to talk about an issue we both care passionately about and that we have partnered on now for a number of years. And with consent, I would like to proceed with a colloquy with Senator Blunt.
Without objection.
Thank you, Mr. President. On October 31, 2013, Senator Blunt and I stood here on the Senate floor to mark a very important anniversary. It was 50 years to the day after President Kennedy signed into law the Community Mental Health Act. It was the last piece of legislation he was ever able to sign. As we know, his life was tragically cut short. And one important part of his life's work, providing full funding for comprehensive mental health services in the community, never came to happen. Instead, behavioral health is funded far too often through grants. And while these grants are important, they're just not enough, because you would never say to somebody who needed a heart bypass surgery, yep, you need surgery, but so sorry, the grant ran out, which is what happens to someone with a mental health crisis or addiction all the time. And you wouldn't say to somebody with a bipolar disorder or substance use, well, we actually would say, so sorry, the grant ran out, and we should not be saying that. Why should health care above the neck be funded differently than health care below the neck? And so this is something that Senator Blunt and I started to work on. We know that that should not be true. Healthcare is healthcare. President Kennedy understood this, and so does my friend Senator Blunt. Right, Senator Blunt?
So glad to be here with you, Senator Stabenow. We've been friends a long time. We've worked together on a number of issues, both in the House, where we came at the same time, and in the Senate when I got to the Senate. But clearly, this is one of the things that I think we both have a strong sense that we've really made a difference, not only how we look at mental health, but also in the way we talk about mental health. You know, Senator Stabenow's point of treating mental health like all other health, and what happens when you do that. We got an award last month when I was home, and Senator Stabenow was virtually in Jefferson City, Missouri for a few minutes from the Missouri Behavioral Health Council, the Excellence in Mental Health Award. Brett McGinney, the head of that council, talked about what they were doing and what they were seeing from what they were doing. Also, we talked about the partnership with community health centers, another thing we've worked together on. And Joe Purley and Brett McGinney are actually both here today, coincidentally, when we're talking about this issue so important to both of them. I've often thought about the same time of discussion we had in 2013, as Senator Stabenow just pointed out. We went through the Community Mental Health Act from 1963, and it became apparent that many of the things that probably should have been closed but were serving a need did get closed, but then the support system didn't come in the way that anybody would have envisioned when that came together. And I can remember in Missouri when some of our mental health facilities, our hospitals, were closed, and that was a fine thing if you had what the bill that President Kennedy signed had in mind, and I think what we've had in mind. One of the things that we've looked at is we've looked at the 41 states now that have some effort, some unit of excellence in mental health, the certified community behavioral health centers in their state. Maybe it's a big county, maybe it's a city that was able to qualify with the 365 days a year, 24/7 standards with the kind of staff available that you have to meet that criteria first. But we now have 8 states, including Michigan and Missouri, in this process. And one of the things that's happening in all of those units is keeping track of the person's other health care challenges when you're dealing with their mental health care challenges. NIH says about 1 in 5 adult Americans has a diagnosable and almost always treatable behavioral health issue. And 1 in 5 adult Americans probably has other health issues as well. In fact, they obviously would have. And one of the things we've been trying to keep track of is what happens in the real confined healthcare world when you deal with people's mental health problems like they were any other health problem. Do they start showing up at appointments more frequently? Do they take the medicine that they're supposed to take for either behavioral health issues or other health issues? Eating better, sleeping better, feeling better about themselves. And I think it's pretty clear and totally logical that that would be exactly what happens. You know, another thing we've seen after that 50 years of whatever happened in mental health between October '63 and the day we were on the floor in 2013 is, in so many ways, the police department, law enforcement, and the emergency room became the de facto mental health system for the country. And we've had people come and be part of press conferences with us, Senator Stabenow, and talking about fewer people being taken to the emergency room, the importance of having a contact that you can make, maybe a place that's not only a place to spend a night, but also a place to then, for you and your family, to know that you're going to have an ongoing opportunity to have a relationship to deal with your mental health problem, just like you would if you had to be taken to the hospital to deal with other problems. And we've seen some things there, Senator Stabenow, you may want to talk about a little bit with everything from the iPad that law enforcement officers and the crisis intervention team uses in Springfield, Missouri, and other places in our state, to where they can immediately link the person that they're dealing with up on the screen of the iPad with the behavioral health counselor that's there any time of the day, fully manned, 24/7, and see what begins to happen when a professional is dealing with a person in crisis. And I've seen that happen, and I'm sure I was there with probably the best crisis intervention center that the police department had, person that they had. But you could tell a difference when they start looking at that screen and talking to somebody, not only as a behavioral health specialist, but also who's just a little bit removed, but totally prepared to enter into that discussion. And we've had lots of people talk about the impact on departments and emergency rooms. Senator Stabenow.
You know, Senator Blunt, I couldn't agree with you more. And I don't know about you, but when we first started and we knew this was going to be a step-by-step process, we weren't able to go nationwide. We had to prove the concept would work of really providing comprehensive services, not just what is done in most states, like in Michigan, where it was Medicaid funding for people seriously mentally ill, but if you weren't seriously mentally ill, there was no support for anybody else. And so doing a concept like federally qualified health centers, which I've been so proud to be your partner on, where you say, okay, if you meet high standards, we will fully fund your capacity then to provide services if you meet high standards, which is what the whole point is. And after only 2 years of doing that with the 8-state demonstration project, I was really blown away, and I think you were too, that after only 2 years, that the kind of results that they were able to get was so meaningful. And HHS, and by the way, under both Democratic and Republican presidents, have embraced this and supported this, which has been wonderful. But after only 2 years, they found 63% fewer emergency room visits. So, and I remember being in one of the press conferences we did with a police chief from Oklahoma, talking about how it was so difficult if they had someone that needed care, and then they would drive hours and go sit in the emergency room with them. And an officer would be off of their regular duties all day, sitting with somebody in the emergency room. And so to have a 63% reduction in the number of folks sitting in the emergency room because they couldn't get help, and then to have a 60% reduction in the number of the time in jail. And so, I'm not surprised that sheriffs and police chiefs law enforcement officials across the country are our biggest supporters in terms of having comprehensive community behavioral health clinics, because they want people to get help. They don't want them going to jail, just sitting in jail. And the other thing that was so important, I thought, was about a 41% decrease in homelessness. And so, and oftentimes the iPad that you're talking about may be someone on the ground, on the street, and an officer will be asked to respond. And the fact that they can put someone, a social worker or a psychologist or someone, on the iPad, on FaceTime basically, to talk to someone and get an initial diagnosis of what's going on, what kind of help they need, where they should go, and so on, has been so effective. And I know for law enforcement, it's such a relief that they have tools that they can use. And we're seeing that over and over again. One of the things we require, of course, is to be able to get this full funding as healthcare, that you have a 24-hour psychiatric crisis operation, which I think has been some of the most important pieces of it. So I don't know about you, but the results to me have been amazing. And we now have 10 states in demonstration project, and we're ready to offer this opportunity to states across the country.
Well, we are, and you know what you were talking about the getting people into the healthcare system instead of the criminal justice system is obviously what one of the goals we should have. Missouri was started in January 2017, and in that first 4 years, they served more than in these certified centers. They served more than 150,000 Missourians, more than 3,500 veterans, and that was a 41% increase over the 4 years of not being in the program to being in the program. And not only did you serve people, but because of the way this is set up, you're able to serve people so much more quickly. You're able to have the staff that you can have because you know you've got the funding you need to have the staff. Largely, this is an increase of the Medicaid coverage, but the other Medicaid costs go down more than the behavioral health costs add to the system. And you know, we've always known that this was the right thing to do. Right thing to do in the long run, right thing to do for police officers, right thing to do for the emergency room, right thing to do for the prison system, right thing to do for people being at work. But I think what we're showing here is not only is it the right thing to do and saves money over time, but the right thing to do and largely pays for itself, and maybe more than pays for itself, within the immediate context of healthcare. And that's one of the things we're looking at. And you know, what we saw in the last 2 years with COVID was the real crisis that became part of that healthcare crisis, the mental health crisis of isolation, of people who develop some kind of dependency. You know, if you don't have a mental health problem before you become dependent on opioids or something else, you have one as soon as you become dependent on those problems. The suicide numbers went up, and having a structure in place ready to reach out and man the suicide hotline to get people to where they need to get. You know, there's no waiting list for somebody who's thinking about doing harm to themselves or others. We need to have a society where we understand that's an immediate problem. It has to be dealt with immediately, and it's a societal, not only a societal goal, but actually it should be one of our primary responsibilities in the society. And I think that's what we're seeing here over and over again, Senator Stabenow.
I agree. And you know, when I think about COVID and all the increased stress on children and young people, and as you said, the increased a number of suicides and all the pressures on everyone, from those on the front lines that were taking care of patients in the hospitals, and the stress of families and so on. We know that it's even more important that we eliminate the stigma of what it means to ask for help, mental health help, or if you have an addiction, to be able to ask for help. But it's not enough just to eliminate the stigma. You have to have the service. You have to have the service in the community. It has to be quality services. It has to be funded in a structural way where you're supporting the staff. And again, modeling this after community health centers, which are widely supported. Every community in the country, strong bipartisan support, by our picking up that model and basically saying we need to do that for mental health and addiction as well as physical health. We're just extending something that has shown such success in the community. And now, because of what's happened and all the pressures under COVID and so on, it's even more important that folks who need help can be able to get that. You know, I think of someone who has struggled with addiction their whole life, and they finally get the courage up. They're going to go ask for help. The ability to walk into a clinic, say, I need help, and to have somebody say, come on in.
I think in almost in all of the states that once they get this fully running the way they hope it will, that everybody that needs to be seen the first day is seen the first day.
Right.
You know, there may be occasional evaluation where you talk to somebody and realize this is something that you don't have to put at the very front of that day's line. But if you need to be at the front of the line, you get to go to the front of the line. If you need to be seen the first day, you get to be seen the first day. No more 7-day waiting period for a crisis moment.
Right.
People still may have to occasionally wait and come back tomorrow or come back Wednesday or whatever the schedule might be. And I think that's critically important. And then now, Senator Stabenow, what you and I are trying to do is to further expand the opportunity. You know, the president said in his State of the Union message, let's get all Americans the mental health services they need. That's a quote. Let's get all Americans the mental health services they need. That was a goal in the President's State of the Union message. It should be a significant goal for the country. And what we'd like to see happen in this Congress is the expansion of excellence in mental health to every state that wants to do it. Initially, we had 24 states apply to be part of the 8 pilot states. 19 of them went all the way through that entire process. You know, all 50 states may not apply, but we'd like to create an environment where all 50 states could apply. And frankly, every time we get a score on this bill, the score is a little lower than it was before because I think the facts are beginning to persuade even the Congressional Budget Office that this makes economic sense to do, and there may be some startup cost, but the long-term cost may be actually long-term savings. If you can do the right thing and save money while you're doing it, Mr. President, that's a pretty good place to be in for a society or a government or a country. And that's what we're trying to get done, Senator Stabenow, in this Congress.
Absolutely. And we invite all of our colleagues to join us. We have a great bipartisan effort going on with our Excellence in Mental Health and Addiction Treatment legislation of 2021 that would open the door for all states. We know that many, many states and certainly local communities are very interested. We can do this. We can actually get this done. And when I heard the president speaking about this, I know I had a big smile on my face, and I think you as well, Senator Blunt, we were like, all right. This is the next step. I'm so excited to see the president agreeing with this and speaking about it in his State of the Union. I'm looking forward to his including this in his budget, which will be coming out very soon, supporting and embracing a nationwide program. And I am just so very, very pleased that this is a model that frankly has survived both Democratic, Republican presidents, Republicans, Democrats, House members, Senate members, local communities, governors, and so, because it works. Everybody is looking at this. Everybody.
And you can have a community behavioral health center working with a primary care center, or you could have an independent provider working with their other healthcare provider, or vice versa. It's very interchangeable. The one criteria for the certified community behavioral health centers is the level of staffing, 24/7, 365 days a year, always available to be that critically important partner that people with a mental health challenge need.
Absolutely.
And frankly, their families and people who care about them need it as well. You know, this is a big challenge for the individual that has a behavioral health problem, but it can be an equally big challenge for people who care about them.
It really is about families. And so, Mr. President, I just want to close by saying I am so grateful for the partnership that Senator Blunt and I have had. He thinks he's retiring at the end of the year. I'm actually going to put him in a closet and not let him leave because he has been such a champion both in his role on appropriations as well as partnering for long-term funding. This is important. This is something real and tangible and meaningful that we can all do together, and I'm excited and hopeful we're going to take the next step this year together.
We are too, and Mr. President, we look forward to you joining us in this effort.
Absolutely. Thank you.